Congress, as we know, passed and the President signed the CARES Act. But as a result of this bipartisan legislation, we have gone through the bill and we have confirmed New Hampshire will be receiving at least $1.25 billion in COVID-19 relief. It's an unprecedented amount of relief for the state of New Hampshire, but given the unprecedented times and the severe needs from families, education, businesses, individuals, there is going to be a need all the way around. So while this is a large amount of money, it is being allocated and dedicated to a variety of different programs throughout the state. Among the highlights, the federal legislation creates the Paycheck Protection Program, where small businesses can get 100% forgivable loans to cover the salaries and benefits of their employees, mortgage interest, rent, and utilities for up to 8 weeks. Again, a really incredible opportunity for a lot of the small businesses out there. There's also support for the Child Care and Development Block Grant, financial support where funds can go towards our daycare initiative that we announced just last week. So a lot of the subsidies and supplements that we provided in our child care and daycare initiatives, again, are going to now be backed by the federal government, which is very exciting. There'll be additional support to the Substance Abuse and Mental Health Services Administration for mental health and substance use disorders through certified community behavioral clinics. In addition to the $50 million healthcare relief fund that we set up very early on in this process, the federal legislation will provide additional grants to hospitals and nonprofits and other institutional providers to help cover the unreimbursed healthcare costs of this COVID-19 crisis. We've started a plan on how to best operationalize all of these different opportunities, and we'll continue to dig into the details so that we truly can better understand what the state allocation will be, what restrictions the federal government may have placed on them, and again, just how best to use these funds for the citizens of New Hampshire.
First, an update. On the federal side, Saturday night, I was called that we have successfully secured in Colorado a major disaster declaration from the federal government for our state of Colorado that unlocks access to additional resources. We were able to announce that Saturday night. I want to thank the President for granting that request and most members of our congressional delegation who supported that request, which really underscores the seriousness of the challenge that we face. I want to have a few slides that I wanted to go over with you here today. But before we do that, I just wanted to talk about how this crisis will be with us for days and weeks and indeed months ahead. And it's important to pace ourselves in this, just as we are and the people here at the Emergency Operations Center, just as you are. We need to get through this in a sustainable way.
And again, this is something that is so very, very important. We got two variables. One is all of us slowing this coronavirus down by distancing from others. The other is it's a race for time as we build out the hospital capacity. And it's not just, of course, the hospital capacity. It's also buying us time, not just to build out the hospital capacity and get ready for that, but also allowing more technology to come online that helps us in so many ways. For example, what Battelle did and what we are getting this week now for the first time. So all of this technology that's coming online, every day that we can delay the real onslaught of this tidal wave that's coming to Ohio is a day that we can see the technology move forward and we can get better ready for that.
Well, so as you know, I'm the chairman of the National Governors Association. We have another call at 11:30 today with the president and vice president. It'll be our sixth one. It's the number one concern of every governor in America, that both the federal and the state level, everybody's doing everything they possibly can, but there's a tremendous shortage, which you're hearing over and over again from everywhere, from the federal leaders and from every governor, that there's just a tremendous shortage, which is why we called on the president to ramp up the Defense Production Act, which is why we're pushing FEMA to try to distribute everything in the national stockpile. And it's why every state is trying to take every step possible to ramp this up. But this is a case that's not just in this nursing home or not just in our state, but every single hospital across America, and frontline workers and people that are really being exposed. We've got this crisis in America that has to be addressed, and everybody at the federal, state, and local level is trying to grapple with this.